My name is Dr. Chantae Sullivan-Pyke, and I am a reproductive endocrinologist. In my practice, I help patients understand what's happening to their bodies as it relates to reproduction and options they may have to conceive. It's physically impossible to be pregnant and on your period, but if you are bleeding, here's what you should know. Bleeding in early pregnancy is not considered normal. However, mild spotting that happens after intercourse or a pelvic exam is not unusual because of increased blood flow to the cervix during this time of pregnancy. What is concerning bleeding in pregnancy? Any bleeding may be of concern, but heavy bleeding like a period warrants immediate evaluation. In particular, if bleeding is accompanied by pain, this could be an ectopic pregnancy, which is a life-threatening emergency. Bleeding in early pregnancy is also considered a threatened miscarriage and should be evaluated. In the first trimester when bleeding occurs, we often are worried about ectopic pregnancy and miscarriage. Miscarriage happens in 10% of pregnancies, so it's a very common condition. Therefore, any concern for miscarriage should be evaluated. Later, in the second or third trimester, bleeding may occur because of problems with the placenta, such as premature separation of the placenta from the uterine wall, called placental abruption, placenta previa, in which the placenta covers the cervical opening, and placenta accreta, in which the placenta embeds within the muscle of the uterus. All these conditions are emergencies, and therefore any bleeding should be urgently evaluated. So what could it mean if you are bleeding while pregnant? One important thing to know is that bleeding can happen in up to 25% of even normal pregnancies. I know this happened to me, and I had a beautiful baby boy. Bleeding may occur due to large amounts of veins in the cervix, making it bleed more easily after penetrative sex, pap smears, and so forth.